Hello there, it's Jennifer McCreath. Today is Monday, May 28th, 2012. I am turning this camera on to announce that I will not be appealing the dismissal of my human rights complaint. 3 years ago I filed a human rights complaint with the Newfoundland Labrador Human Rights Commission against the Newfoundland and Labrador Department of Health. The issue I'd raised was with regards to the inability to achieve and secure timely access to funding for medically necessary procedures as per deemed necessary by my doctors here in Newfoundland. As it turns out, I have reviewed the Human Rights Act and spoken with lawyers and other experts in the field. They have determined that the issue here is not with the Human Rights Act or the Human Rights Commission in their work. The issue is I guess, a scoping issue of the Human Rights Act and the Human Rights Commission, as well as a healthcare policy issue. Unfortunately, unlike many other human rights acts and human rights jurisdictions in the country, the Commission here in Newfoundland can only look at what's in the Act specifically. They do not have the power or the authority to send suspicious public policy matters for inquiry. And that's essentially what we have here. Human rights may appear to be or healthcare access and healthcare funding may appear to be a human rights issue, but in Newfoundland it does not specifically fall under the jurisdiction or the mandate of the Human Rights Commission. Ultimately what we have here is a question of health policy. My issue was that the healthcare funding folks would not accept a recommendation from my local Newfoundland doctors regarding care that I needed. We've got a piece of legislation that's now 16 years old that says transsexuals must travel to Toronto, Ontario and go through a program at Clarke Institute of Psychiatry, now more commonly known as CAMH, and receive a positive recommendation from them in order for the Newfoundland government to agree to provide funding for the care that was needed. So I hate to break it to you folks, transsexuals in Newfoundland, you still cannot get funding for sex reassignment surgery unless you travel to Toronto and go through the program there. This, in my opinion, seems absolutely ridiculous. We have doctors here who are caring for transsexuals, such as myself, and have done a pretty darn good job caring for those transsexuals. It seems shameful and ridiculous to slap those doctors in the face and not accept their recommendations, and even more so despicable that trans patients either have to fork out extra money up front to travel to Toronto, go through a program at a notorious institute, just for a chance to have funding for bottom surgery. Other issues I raised was the fact that they would not cover top surgeries and other procedures, nor would they fund procedures performed at GRS Montreal, Canada's only sex reassignment clinic. So I did not appeal. I did not take this to the Supreme Court. I could have done that just for a media blitz, but I would have lost. What we really need to do now, people, is one, we need to lobby government through moral suasion and perhaps through other legal means. One, the Human Rights Act needs to be amended. First and foremost, the Human Rights Commission should not be reporting to the Department of Justice Minister. They need to be reporting to a neutral body such as the House of Assembly. Secondly, we need to get that act changed. One, to ensure that there's explicit protection for transsexuals under the terms gender identity. That's a whole other issue worthy of further investigation, whether or not that played a role in this dismissal. And secondly, we need to ensure that the adjudicators and the commissioners have the power and authority to do what's morally right. If they see an issue, they need to be able to push that forward instead of dismissing it. Secondly, we need to engage the health field. One, we need to talk to the doctors. We need to talk to CPATH and WPATH. and find out what's their stance. Doctors, you've just been slapped in the face. You're incompetent. You can't handle this task, apparently. How do you feel about that? Do you care? Right now, I'm not so sure that they do. Most doctors they're busy with cis patients, and trans is only a small portion. If they're not deemed competent to recommend funding for care, it might not be in their best interest to stir the pot. Trans people, we need to come together. We need to align ourselves with each other and work with doctors and healthcare professionals to push for the recognition that doctors are capable of providing care for transsexuals here in Newfoundland, and that their recommendation should be sufficient to get the care that the patients need. We also need to bang on the doors of the policy makers as well as the politicians and let them know that this is an issue, that it's not right, and we demand a change. Please get in touch with me, jennifermccreath.com. You can also go to empath.net, which is a new organization that I'm looking to get launched shortly, the Newfoundland Patients Association for Transsexual Health. Anyone else out there? Let's start talking about this. Nobody should have to go to Toronto anymore for trans assessment. World Professional Association for Transgender Health, wpath.org, is a globally recognized body of knowledge. They say it's not necessary, therefore no politician should be saying so either. Thank you very much.